Hello, myself Dr. Kaushik Bhar, presently attached in the SSKM hospital as a teaching faculty. Uh, Today, I will discuss about the understanding of the cholesterol management. The cholesterol is an essential component of the blood cells and the body tissues, and almost every cell of the body needs cholesterol to function normally. It is essential for producing hormones, vitamin D, bile acids, and helps to digest the fat. Our body needs cholesterol to be healthy, but again, too much cholesterol is harmful for the health, and body produces all the cholesterol it needs to keep it healthy, and body also get the cholesterol from food we eat, which is called a dietary cholesterol. Cholesterol is a fatty in nature and cannot dissolve in the blood, which is watery in nature. So for circulation in the blood, cholesterol is packaged in what is called lipoproteins, which have fat inside, the protein outside. And there are two main kinds of lipoproteins which carry cholesterol in the blood. One is the low density lipoprotein, also known as bad cholesterol, and another is high density lipoprotein, known as good cholesterol. Now, the LDL cholesterol or low density lipoprotein, as it carries the cholesterol to the tissues, including the blood vessels, most of the cholesterol in the blood is in the LDL form. The LDL numbers needs to be low because higher the level of LDL cholesterol in the blood, greater the risk of heart disease. If there is too much LDL cholesterol in the blood, some of the excess build up stuck up in the inner wall of the blood vessels, leading to atherosclerosis, and thus increases the incidence of hypertension, coronary artery diseases, stroke, peripheral vascular diseases. Now come to the high density lipoprotein or HDL cholesterol or good cholesterol. We often use the H of the HDL cholesterol is healthy cholesterol. This is a good cholesterol as the it removes the bad cholesterol from the various organs and it clears it from the body. So it can also remove the excessive cholesterol accumulated in the blood vessels. And HDL level numbers should be high, as low level of HDL cholesterol may lead to increased cardiac risk. And the other common type of fat in the body which can build up in the blood vessels is called triglyceride, and this triglyceride comes from the food we take. High cholesterol usually has no signs or symptoms. The only way to know whether you have a higher cholesterol level in your blood is testing the blood. And the simple blood test, which is known as lipid profile test, which can measure the cholesterol level in our blood. The total cholesterol which is present in our blood, one is HDL cholesterol, one is LDL cholesterol, and another is triglycerides. And the levels of these different types of lipids or cholesterol, the total cholesterol level to be maintained physiologically in less than 200 milligram per deciliter, and LDL cholesterol level to be maintained less than 100 milligram per deciliter in normal individual, and HDL cholesterol, which is a good cholesterol, to be present more than equal to 60 milligram per deciliter, and the triglyceride level should be less than 150 milligram per deciliter. So if the cholesterol is found to be high, the doctor will recommend the various treatment options such as dietary modification, lifestyle changes, and the medication to lower the blood cholesterol level. Though cholesterol levels can be lowered with lifestyle changes, dietary modification, but many people needs cholesterol lowering drugs in addition to the lifestyle modification. Now, what are the different drug treatment for cholesterol? One group is the statin, which is a HMG-CoA reductase inhibitor. The statin is often used for cholesterol lowering agents, and it is a very safe for most of the people, and this statin is considered as the first line therapy for cholesterol management. Another group of drugs known as bile acid sequestrant, it also lowers the LDL cholesterol in combination with the statins. Another group is nicotinic acid, which increases the HDL level and lowers the triglyceride and LDL cholesterol. Another is fibric acids, which lowers the LDL and somewhat, but are used mainly to treat the high triglyceride level. So fibric acid particularly targets the triglyceride level, which is often we get from our food. And the cholesterol absorption inhibitors, that these drugs lowers the LDL and can be used alone or in combination with the statin and other drugs. So if the doctors prescribe medicines as a part of the treatment plan, be sure to take it regularly as prescribed and also implement the healthy lifestyle changes along with medication. The combination of the medicines and healthy lifestyle changes can help to lower the cholesterol and control the risk factors and to prevent the complications like coronary artery disease, strokes, peripheral vascular disease, hypertension. Now, come to the healthy lifestyle changes. The healthy lifestyle changes that includes, first thing is the healthy eating. So what one eat has a huge impact on their health. Our body makes all of the cholesterol it needs, which is why experts recommend that the people eat as little dietary cholesterol as possible while on a healthy eating plan. So what one can do: number one, to limit the foods high in saturated fats. The saturated fat containing foods are cheese, fatty meats, dairy products, tropical oils, and highly processed foods, particularly the fast food. You have to avoid this sort of food as much as possible and choose the foods which are low in saturated fat, trans fat, salt, and added sugar. So these include the lean meat, seafood, fat-free or low-fat milk, yogurt, whole grains, fruits and vegetables. And the eat foods which is having naturally high fibers. These are fruits, vegetables, the oatmeals, beans, unsaturated fats. These are the foods. So you have to avoid the saturated fats and you have to take high fiber diets. This is the healthy eating plan. And the second thing is becoming more physically active. You have to be physically active every day. So the thing is that you have to do at least 30 minutes brisk walk for 7 days and at least 150 minutes in a week. Third one is the avoid some addictions like smoking, alcoholism, you have to reduce or stop it. So smoking lowers the HDL cholesterol and it is a well-known risk factor for heart disease. Fourth one is losing body weight. So being overweight or obese, that tends to increase the bad cholesterol and it lowers the good cholesterol. So reducing the weight for the obese individual, that can lower the cholesterol level. A weight loss of as little as 10%, that can help to improve the high cholesterol number. Fifth one is managing stress. The chronic stress can someone raise LDL cholesterol level and decreases the HDL cholesterol level. So stress also can lead to increased risk for the heart disease and the stroke, etc. And last but not the least, the get enough good quality of sleep. This good quality sleep means a very sound sleep, particularly nocturnal sleep, at least 7 to 9 hours a day. So these are the 6 things which, if you can acquire, then you can reduce your cholesterol level, the bad cholesterol level, you can increase your good cholesterol level, and you can reduce the risk for the heart disease, hypertension, and stroke. Now, in summary, I want to say that the session as a high blood cholesterol is one of the major controllable risk factor for the heart disease, heart attack, and stroke. No matter your age, you can take steps each day to keep the cholesterol level in a healthy range. So high cholesterol can be prevented and managed by making a healthy choice. The healthy choice includes healthy dietary habit, healthy lifestyle, regular exercise, stop smoking, having a stress-free life, and have enough sleep that can check your cholesterol and that can make you healthy. Thank you. Thanks a lot.